Hello, my name is Erika Garner, and this is my health literacy intervention presentation. Health literacy is a factor of public health. In this presentation, I will discuss what is health literacy, cultural competency, and health inequities. I will also present an intervention that addresses these factors. What is health literacy? According to the Healthy People 2010 report, cited in David Becker's article, The Meaning and the Measure of Health Literacy, health literacy is the degree to which people can obtain, process, and understand basic health information and services needed to make appropriate health decisions. Therefore, health literacy is based on the skills of the individual, which can evolve over time depending on their education, technology, and new information available. This makes for a dynamic issue to tackle. Health literacy is important to public health because people need to be able to understand how to take care of their health. If reading, comprehending, and working with numbers are barriers for the public, people will struggle with those tasks that might seem like second nature to others. As you can imagine, this can alienate people to where they might not feel comfortable asking for clarification, helping with reading paperwork, or being able to complete take-home tasks after medical care. It is required to be able to process information anywhere there are medical services, such as reading prescription bottles, filling out forms, understanding nutrition labels, and so much more. Cultural competency. Cultural competency is needed to understand health literacy issues. Cultural is the behavior pattern within social or religious groups that include actions, customs, values, and means of communication. Competence is the capacity to function effectively. Therefore, cultural competency involves professionals working together in a system cross-culturally. Elements of this factor include valuing diversity, self-assessing related to culture, being conscious of cultural interactions, having adequate cultural knowledge, and developing services that reflect cultural understanding. Competence is required when developing policies, providing services, and developing promotion or product materials. Health equity. Health equity is when there is not a difference in health when comparing groups that are exposed to social and economic policies and practices that create barriers for opportunities. When there is evidence of health illiteracy that is not addressed, health inequity occurs. Through health inequity comes health disparities. Health disparities are the difference in health status between distinct populations such as gender, ethnicity, and income. What does this all have to do with public health? Like mentioned before, health literacy is in almost every aspect of medical care and health services. People can be illiterate in print or oral delivery. Either way, if there's a lack of understanding and an inability to obtain this information, a barrier is formed. This barrier, possibly created by having a lack of cultural competency, leads to health inequity. Outcomes of health inequity are high maternal mortality rates, high child death rates, diseases due to poverty such as tuberculosis, a large variance between countries in life expectancy numbers, and financial costs to societies with health inequities are present. This is reported by the WHO in 2011. According to the health.gov, 14% of adults have below basic health literacy skills. This means 30 million people do not have the skills to manage their health. This population is also more likely to report their health as poor and lack health insurance. Individual and systematic factors. Health literacy is dependent on individual and systematic factors. Culture is a factor of health literacy. Another factor is the set of communication skills a person or professional has developed over their lifetime. Communication skills developed over time are affected by education level, cultural, and language. Materials need to be provided that are created with cultural competency to make for an effective means of communication. The knowledge base, lay or professional, that person has is an individual factor of health literacy. This helps with developing understanding when presented with medical information. If there is not a basic knowledge of the topic, understanding is hard to achieve. The demands of the healthcare system also affects health literacy. Paperwork is required for documenting all medical services. Billing processes are a huge aspect of the system. These both require a level of literacy to provide written information by the patient. Each person's individual situation comes with their own demands. Depending on the medical issue or service, there are directions that they need to be able to comprehend, handouts to review, and conversations that have to be had with medical professionals. This can put patients in stressful and uncomfortable situations if they are not treated with the care that they need. This care would include layman language, translation, or large print directions. Health literacy can affect people's ability to do tasks related to medical care. The healthcare system is a complex maze if a person does not have the ability to navigate that web. First off, people need to be able to understand where to go to get medical assistance. They need to be able to find the correct doctor or medical provider and also have their contact information. They need to be able to get to their destination, which could include understanding directions, reading a map, or understanding the bus route. Then, when they get to their service provider, they have to be able to provide personal information by filling out complicated forms. The ability to care for themselves after the medical assistance can be affected by health illiteracy. Self-care includes reading directions, understanding labels, measuring medications, and calculating blood pressure, sugar, and cholesterol levels. Some of these tasks require math skills. People also have to have the skills and capacity to compare health care plans, which means understanding copays, premiums, and deductibles, which are all factors of health literacy. So what can be done? Medical professionals should use plain language. Plain language is communicating information in a way that a person that is hearing it for the first time can understand it. Information should be organized with the most important information first. It should be broken down into understandable chunks so complex information can be digested more clearly. The language should be simple and the voice of the material should be active. Technical terms should be defined, acronyms should be spelled out, and medical jargon should be avoided completely. To support health literacy efforts, President Obama signed the Plain Writing Act of 2010 that requires, by law, that federal agencies use clear government communication that the public can understand and use. Medical professionals should understand their population. Medical providers should know their community. Cultures, education levels, socioeconomic status, and age all vary from each community. By knowing who they are working with, medical professionals can provide the correct level of communication needed to address health literacy factors. Different cultures may have different ways of communicating. Education levels will affect the language used. Age might be a factor because of the size of print needed or the volume in which the provider uses when speaking. Providers should never assume the abilities of their patients, but always be conscious of the ways they are communicating with them. The elderly population is affected by health literacy. According to the United States Department of Health and Human Services Administration on Aging, the older population, persons 65 years of age or older, is the fastest growing population in America. About 1 in every 7 Americans are over the age of 65, numbering to 46.2 million people. This population is plagued with health issues. According to the National Council on Aging, chronic disease affect about 92% of this population. Chronic diseases include heart disease, cancer, stroke, and diabetes. These 4 diseases cause almost 2/3 of all the deaths each year. On top of that, the costs related to chronic diseases make up 75% of all the money spent on health care. Another issue that is prevalent in older adults are mental health issues. 1 in 4 adults experience some kind of mental health issue, including depression, anxiety, and dementia. Mental health increases disability and impairment, decreases quality of life, and is associated with poor health outcomes. Hearing and vision loss can also affect their ability to understand medical information. Intervention, health literacy, and chronic disease management. So what can be done? It has already been mentioned that preventative care is affected by health literacy. Chronic disease requires preventative care as well as medical care. People first need to know how to prevent chronic diseases. They also need to understand how to manage it. Chronic disease management takes a level of understanding of how to take care of themselves to make sure they do not escalate to a fatal outcome. Checking for health literacy problems. For an intervention to be effective, providers have to recognize the health literacy issue. They need to be attentive to their patients so they can pick up on clues of health illiteracy. Patients often will make up an excuse instead of asking for help. Some examples include leaving their glasses at home, they feel too tired, or they're going to push the reading off until they get home. Patients may also pull the text closer to their face and even squint. They may act nervous, confused, or even frustrated when handed forms to fill out or information to read. Medical providers should also create a supportive and respectful environment for all patients to feel comfortable in. For example, receptionists should give the patient their full attention when checking them in. They should not be on the computer for other reasons unrelated to the patient, on their phone, or doing other paperwork. Print communication. Intervention related to health literacy is to first make sure the print is large enough for the patient so they do not have to strain their eyes to read it. Material should be printed in large print so patients can read it on their own. For those patients that can't read, providers should offer to help filling out forms or walking them through handouts by reading it out loud to them, according to Cornett of 2009. Oral communication. Health literacy is not always about their ability to read. It is also related to the understanding and comprehending of what they read and what they're told. Providers should speak slowly and clearly. Medical terms should be explained and plain language should be used. This also goes for print material. Well-organized handouts should be provided that are not overcrowded with information, and most importantly, information is listed first. Hands-on practice with guidance. When health literacy is related to chronic diseases, understanding how to manage their disease is vital. Teaching patients how to measure blood pressure, providing guides to help them evaluate if they are in a safe or unsafe range, and practicing with them to check for understanding are always ways to help health illiteracy. Prescriptions should be given with clear directions and a reference information or contact number if they have any questions or concerns. Novellas, form of communication. Another novel way of providing information is through picture book form. Photonovella is a health education item that uses photos paired with easy-to-read text to demonstrate the task that needs to be done by a patient or explain the information provided by the professional. There are lots of research that supports the use of photonovellas in the medical field. One example is the work done by the University of Texas School of Public Health with the Center of Disease Prevention and the National Alliance of the Hispanic Health on a project to decrease hypertension in Hispanic population. Hector Balcazar, a professor at the University of Texas School of Public Health, developed Spanish photonovella addressing how to control hypertension. Photonovelas have proven in research and applied health promotion studies to be very effective in reaching Hispanic and Latino populations that have been traditionally proven to be difficult to reach, says Balcazar. One issue with this method is that it could be expensive to create. One idea is to have the patients create the photonovelas themselves. This empowers the patient through the experience and provides an educational material that reflects a certain population. How to implement photonovelas. Dr. Sandy Cornett of Ohio University has developed steps on how to create and implement photonovelas in the clinical setting. Step 1. Obtain resources. The resources needed to make photonovelas include large sheets of paper to storyboard, writing utensils such as markers, digital camera, computer, Microsoft Publisher software to create a professional-looking material, and finding people that represent your target audience willing to participate and have them sign photo releases. Step 2. Develop the content. Pick the topic. When working with older adults, it would be useful to choose something related to managing a chronic disease, such as diabetes. List the points that will be covered and start coming up with the ideas for the images. By using a grid, draw a large piece of paper, creating a visual outline of the story by adding text and images in the sections. After this brainstorming phase, come up with the final version of the photos and text. Step 3. Production. Using the grid and willing participants, set up the scene for the photo shoots. Keep in mind gestures, expressions, and clothing when taking photos. Using the software, pair the photos with plain language bubble text to illustrate dialogue. Have others edit for the final product. Step 4. Pilot and evaluate. Pilot the product. Use focus groups or survey a small group to see how useful they think the material is. If it keeps their focus, if it teaches them anything, and how accurately the material is perceived. Also assess participants' attitudes towards the material and their intent to change their behavior due to this presentation of information. Here's one situation that illustrates the use of this health literacy intervention, including the ecological model of health behavior theory. The intervention is geared to cut down barriers so elderly patients can understand the information given to them by their health professional. At the intrapersonal level, a knowledge base is needed to be built so that understanding can be achieved. A barrier to building that knowledge is not being able to read the information due to font size. Medical providers would provide material with larger font size, printing information on the front and back of the sheet to save paper and money. Magnifying glasses can also be set out in the waiting rooms and patient examination rooms. Providers should give the patient the information and then give them some privacy so that they can use these magnifying glasses without feeling judged for their inability to see the writing on their own. Magnifying glasses can be purchased for a cheap rate at the dollar store or online. At the interpersonal level, the patient provider should be aware of any health literacy issues that may be barriers for their patients. This information should be acquired by paying close attention to each patient to pick up on any clues that they may be giving hinting to this inability. They should also make the patient feel comfortable in the environment by active listening, making eye contact when they are talking, and answering any questions the patients might have. Medical professionals should be available to help patients walk through self-care tasks, checking for understanding, and assisting with paperwork when needed. At the organizational level, healthcare providers should promote material that is written in layman terms. Acronyms should be always spelled out so that patients do not have to struggle or feel inadequate when trying to understand the language. Websites should be user-friendly, making it easy for patients to search for services and find contact information when needed. Services should promote reminder systems for patients so they can have help remembering when and where their appointments are. This is especially important for the elderly population who might have a higher volume of appointments and doctors than others, as well as possible dementia. At the community level, photonovellas can be developed to promote medical education to people of all literacy skill levels. This will increase public awareness of the issues. Specifically, related to the elderly population, the topic should cover chronic disease management, could cover chronic disease management and self-care skills. At the policy level, health providers can encourage policy change to promote insurance coverage for screenings. Policy should be written with cultural competency in mind and promoted for the public to be able to understand. Here is one situation that illustrates the use of this health literacy intervention, including the ecological model of health behavior theory. The intervention is geared to cut down barriers so elderly patients can understand the information given to them by their health professional. At the intrapersonal level, a knowledge base is needed to be built so that understanding can be achieved. A barrier to building that knowledge is not being able to read the information due to font size. Medical providers would provide material with larger font size, printing information on the front and back of the sheet to save paper and money. Magnifying glasses can also be set out in the waiting rooms and patient examination rooms. Providers should give the patient the information and then give them some privacy so that they can use these magnifying glasses without feeling judged for their inability to see the writing on their own. Magnifying glasses can be purchased for a cheap rate at the dollar store or online. At the interpersonal level, the patient provider should be aware of any health literacy issues that may be barriers for their patients. This information should be acquired by paying close attention to each patient to pick up on any clues that they may be giving hinting to this inability. They should also make the patient feel comfortable in the environment by active listening, making eye contact when they are talking, and answering any questions the patients might have. Medical professionals should be available to help patients walk through self-care tasks, checking for understanding, and assisting with paperwork when needed. At the organizational level, healthcare providers should promote material that is written in layman terms. Acronyms should be always spelled out so that patients do not have to struggle or feel inadequate when trying to understand the language. Websites should be user-friendly, making it easy for patients to search for services and find contact information when needed. Services should promote reminder systems for patients so they can have help remembering when and where their appointments are. This is especially important for the elderly population who might have a higher volume of appointments and doctors than others, as well as possible dementia. At the community level, photonovellas can be developed to promote medical education to people of all literacy skill levels. This will increase public awareness of the issues. Specifically, related to the elderly population, the topic should cover chronic disease management, could cover chronic disease management and self-care skills. At the policy level, health providers can encourage policy change to promote insurance coverage for screenings. Policy should be written with cultural competency in mind and promoted for the public to be able to understand. Addressing possible issues with the intervention ideas. Printing and providing material in large font may be costly and possibly offending to the patients. The cost of print could be reduced by printing two-sided. The budget could also split the money used for normal size font material with printing large font material, so no more money is being spent. Researching and collaborating with other providers to share resources could also save money. Providers should also be conscious to not offend their patients by looking for clues to see if they are in need of larger font material. Oral communication. Doctors and medical providers do not have as much time with each patient, so time could be an issue. The intervention asks them to read directions out loud and practice doing the home care tasks with the patient. One solution would be to have interns, nurses, and doctors all share this responsibility. Another would be to spend one evening creating a training video that could be housed online for those patients that have computers and internet access to watch at home when they're doing their task. Photonovelas. This intervention poses the most barriers, however, I feel it could be the most effective. For this project to be successful, providers would have to understand the time commitment and truly value efforts to help with health literacy. A few ideas would be to partner with a local high school or college photography or art class to do this project. High school and college students are always looking for opportunities to volunteer. Larger hospitals, as well as health departments, also have people on staff that jobs are to find funding for projects such as these, provide man hours on the projects, and implement the materials. In conclusion, health literacy is an issue for many populations in the United States. To work toward health equity, providers have to value the effort needed to do what they can to make all their patients feel comfortable and respected. The intervention is geared to better help older adults see, hear, and understand medical information, but there are always obstacles. As public health professionals, they need to see through the barriers to do what is right for their patients. Here are my resources, and all the photos not attributed in this presentation are from pixabay.com or shutterstock.com and are a part of the public domain.